Many thanks for those details. But on what's brewing today, DCDC Health Services, an operator of dialysis centers in India under the DCDC Kidney Care brand, has secured an investment of 150 crore rupees from Singapore-based ABC Impact. The Asia-focused impact investment firm is backed by Temasek. Founded in 2009, DCDC operates over 200 dialysis centers across India, catering to patients through public-private partnerships and standalone company-owned clinics. Joining me now to discuss this further is Aseem Garg, the founder and CEO of DCDC Health. Aseem, thank you so much for taking time out and being here with us on Startup Street. You know, like I just said, you operate dialysis centers under the DCDC Kidney Care brand. If you could sort of take us through how big of a problem this is in India and the kind of impact that you're creating.
Thank you so much for having me here. So in India, we estimate that there are more than 1 million patients who require dialysis. Every year, about 3 lakh new patients come on dialysis. ESRD, which is the end-stage renal disease in which kidneys give away. So the patients require dialysis or they require kidney transplant. So for 90% of the patients, they are unable to afford dialysis. So till now, more than 1 million patients who require dialysis, only about 200,000 patients have access to kind of a dialysis center. And within this, affordability is one issue and accessibility is another issue. At present, more than 60% of the patients are forced to travel more than 50 kilometers to get access to a dialysis center. And a quarter of patients travel more than 100 kilometers to get access to a dialysis center. And this is thrice in a week. And dialysis is something which they require, otherwise they won't be able to live.
Right, absolutely. So it is a big problem, as you pointed out, right? So if you could take us through your key solution, what's on offer at DCDC, and you're trying to provide renal care via clinics as well as take it to the home of the patients, right?
Yes. So basically, as I mentioned earlier, patients need to travel so much to get access to a dialysis clinic. So we are solving for last mile connectivity, and we are opening centers in tier 2, tier 3 towns so that we get so that patients have access to a dialysis clinic near to their houses, and they don't have to travel that much. And at the same time, we want to increase the number of patients who can get access to these dialysis services.
Right, absolutely. And you've raised these funds to primarily support your expansion plan, right? So if you could take us through your current capacity and by how much do you hope to increase this? You're eyeing 150 new clinics, right? So what's the timeline for this?
We intend to open 150 clinics over the next 18 months. We have 200 clinics operational right now, in which we are able to serve more than 20,000 patients. We intend to almost double the capacity in the next 18 months.
So you want to double the capacity in the next 18 months. You know, as you pointed out when you were talking to us initially, you pointed out that affordability is one of the biggest problems when it comes to healthcare in India, right? So how affordable are you and how far is your reach?
We are present almost across India now. Western India is something that we want to take a solution to. We don't have a significant presence in West India right now, but we intend to open centers there. In terms of affordability, see, a dialysis patient ends up spending close to 30,000 a month on dialysis and related diagnostic tests, consultations, and medicines. So it's a big problem. 90% of the population is unable to afford it. But we are grateful for the initiatives taken by the central government and under the able visionary leadership of Pradhan Mantri Modi, who launched the Pradhan Mantri National Dialysis Program in 2016, and then the Ayushman Bharat Yojana, which has enabled patients to be able to afford dialysis. So affordability for dialysis services has definitely increased. And then players like us, what we intend to do is provide affordable solutions, which are almost 30 to 40% lesser when the patients get access to dialysis in a private or a corporate hospital. So our solutions would be for almost 30 to 40% cheaper, but we are providing them at the same quality. Most of our centers, whether standalone or in PPP format, they are NABH accredited, which is a hallmark of quality.
Right. And are you looking to take your services to countries outside India? What's the global expansion plan?
So when we started these services in India, we realized that a lot of countries outside India are facing similar problems. And we feel that the solution that we have developed for the Indian population can be taken to solve these similar problems in countries outside India as well. So we are open to expanding outside India, and we'll be looking to take our solutions to ESRD patients outside.
All right, so eyeing global expansion plans there. All right, Aseem, thank you so much for outlining the growth blueprint you have for your company. And thank you so much for joining us here on Startup Street.
Thank you so much for having me.
Well, on that note, it's time for us to head in.